In this short talk, we will be looking at the antecubital fossa. So by the end of this talk, you'll be able to describe the boundaries of the antecubital fossa, their contents, and also the clinical significance of this region. Before we proceed, pause the video and see if you can remember what the antecubital fossa is and its anatomy to the best of your ability. So the antecubital fossa is that triangular area in the anterior aspect of the elbow. It's bounded, if you look at the middle picture, by an imaginary line drawn between the medial and lateral epicondyles. That's its superior boundary. Its lateral boundary is the medial border of brachioradialis, and its medial boundary is the lateral border of pronator teres. Its base consists of the brachialis muscle, and its roof is made up of the soft tissue and subcutaneous tissue of the anterior surface of the elbow, as well as critically the biceps tendon and the bicipital aponeurosis. When we're thinking about the contents of this fossa, we can look at the arteries, nerves, and veins. So the important artery passing through the antecubital fossa is the brachial artery. It runs deep to the bicipital aponeurosis and then emerges to run on the medial side of the biceps tendon, and at the apex, so the distal end of the fossa, it breaks up into the radial and ulnar arteries, which pass down the radial and ulnar borders of the forearm respectively, the radial artery being more superficial while the ulnar artery runs more deeply. The main nerve running through the antecubital fossa is the median nerve, and it runs on the medial side of the brachial artery through the fossa. It's also important to remember that the radial nerve also runs through the antecubital fossa at its lateral border, so just close to the edge of brachioradialis. In contrast, the ulnar nerve does not run in the antecubital fossa. If we look at the picture on the right, there are some important superficial veins that run through the ceiling of the antecubital fossa. Not always thought of as contents of the fossa, but they pass over the fossa in a fairly consistent way, and can be useful because the anatomy is consistent enough. So the cephalic vein drains the radial border of the forearm and then into the arm, and the basilic vein drains the medial border of the forearm and then into the arm medially. And there is a fairly consistent vein that joins these two, the medial cubital vein. So those are the main points of the antecubital fossa that you need to know about. Why are they important? Actually, one of the important things here is that this area provides us with fairly consistent superficial veins for venous access. So if we have difficult venous access, we know where these veins are, And in the past, we would actually go to them blindly. Now it's recommended that we use ultrasound to find the veins, but at least we know where they are. The deep structures include big arteries, the brachial artery, and then at the distal apex, the radial and ulnar arteries, and two fairly important nerves, the median nerve and the radial nerve. And these pass deep to the bicipital aponeurosis, and this tough structure provides some protection from superficial injury. When we think about injury in the antecubital fossa, any increased pressure or swelling or deformity of this area can put pressure on these nerves and arteries. So for example, in patients with elbow dislocations or supracondylar fractures, the median nerve in particular and the brachial artery can be put at risk. So this was a brief overview of the antecubital fossa. If you have any questions, you can bring these up in class. Just to remind us, we looked at the boundaries and contents of the antecubital fossa and spoke a little bit about the clinical correlates for this area of the upper limb. Thank you.